and we're here to share what's happening at the ground. We're going to take you from the science to the grassroots level, what's happening at the ground level, and some of the experiences that we've faced in the marshals. And we like to use a quote in our daily health work. It's actually our health theme. It's called "Komedi Edmur," and it means health is a shared responsibility. And climate change is one of the greatest challenges, and frankly, it's at the top of our president's agenda. It's talked about everywhere you go. It's at everyone's agenda, but very minimal at the Ministry of Health level. But it is there, and I'm sure I speak for everyone here in the Pacific, my brothers and sisters. That it's an issue that we all face because of our geographical location, the social context, culture is very important to us. And I think that's why we really take it to ourselves. And the Pacific and the Marshall Islands, we face a lot of issues because of the limited resources that comes through. And with the limited resources also, we have complex health systems. And we really need to try to get as much partnership and collaborations and assistance from you, and that's why I guess we're all here together to see how we can do this together. And why is it such an important issue in RMI? And why are we fighting? So here's a little message from one of our youth advocates, and I hope you will take her message.
There was this one moment where we had one of the king tides coming again, and there was this one lady. She was sitting outside in her wooden bed. She was looking out into the water, and she just saw them constantly coming in and then washing into the land. And so she was sitting there and she was just looking at the water, and she was like, what is happening to us? Like, this has never happened before. Yes, all these droughts and king tides and such happens, they're normal. But then the problem is with climate change, things are becoming more massive and happening much more frequently. We've experienced a lot of rising in sea level. This is making us so much more vulnerable and extremely in danger of becoming uninhabitable. It's more of a religious belief that the world is coming to an end, whereas others are saying, okay, no, this is not. It's due to what bigger countries are doing, the carbons that they're emitting into the air, and we're the one being affected by it. People would think, why would we care about 72,000 people living somewhere in the middle of nowhere in the Pacific? This mindset itself, it's unsettling, and it's something that we need to change. This is something that our ancestors found and lived for. It's our gift from our ancestors. And so we would like to take this gift and then pass it on to our younger generations. We're all humans, we all deserve our rights, and this is our land.
There you go, a little message from our youth advocates. Such a strong message that I wanted to share that with you guys. So, in saying that, here's the outline of our presentation, whenever it wants to come up. What we've experienced, some of the national efforts, what we've done, some recommendations from the assessments that have taken place, what do we need from these recommendations, what's in the pipeline, what we plan on doing, and concluding remarks from us. So here's a summary of the health events that have taken place since 1988 to 2016. And in 2016, you can see here, there's about 7 outbreaks. I don't know if I can.
It's not plugged in.
Yeah, okay, that's good. So there's 7 outbreaks that took place. Right here. So there was about 7 outbreaks that took place, one after another. And towards the end of 2016, we had 3 outbreaks that took place simultaneously. That was Zika, mumps, and hepatitis A. And as you can see on the right side, here's a outbreak timeline from 2016 to 2017. And it's evident that we needed some political willpower and some political advocacy to kind of come into place to help us respond to the outbreaks. And we saw that as soon as resources and as soon as response measures were implemented, the rates and the incidence of the events came down. So as you can see here, this is kind of the timeline of how we sought assistance, and we went through WHO, CDC, PHOA, and there's a huge number of assistance that came through to the Marshall Islands. This slide shows the variation in the number of patients with conjunctivitis. And as you can see over to the far left, that's when after the drought that took place, it really spiked up. Yeah. Yeah, and this is all from all across the Marshall Islands. These are all data from not only from the 2 main hospitals, but we also were able to get some data from the Outer Island health dispensaries. Linda?
Good afternoon, everyone. Is it working? I didn't know I was going to be part of this presentation until this morning, so I guess my apologies trying to do a showcase on how, with minimal capacity and little resources, but we still can respond to emergency. So when we, after we, these are some of the national efforts and what we've done in response to these outbreaks. And when we get the notice of or a confirmed case, we then, without the environmental health unit, we sort of called in all our other partners and local partners and stakeholders to come and plan our response. And from there, we then have our Madam President, Her Excellency Dr. Hilda Heine, declare the emergency or the state of emergency declaration. And then from there, we showed up to collaboration in terms of response to the outbreaks. And these are some of the key activities that we have in place and have so far. As from learning our lessons from these outbreaks, we then try to have our unit, and there's assessment on that has been done by WHO, and it's been completed. And we also have identified staff to work in the environmental health unit, and then our vector control management have been drafted but not endorsed yet, and our EpiNet and incident command system have been placed and it's been completed. And our strategic plan already been drafted and probably ready to be endorsed and execute.
I also want to emphasize that prior to all of these events, RMI did not have an environmental health unit. So when these events took place, it really prompted us to, and also to prioritize the establishment of an environmental health unit. And as I said in my introduction on day one, the government has, for this year, prioritized and allocate some funding to support the establishment of the health unit. And I also want to mention that, the health effects of the floods and the drought, and, it has really prompted some of these government cross-sectoral agencies to really come together to realizing that there's minimal funding coming into in country, to try to see if it can do like a multi-sectoral approach. And even though it was an ad hoc respond, it worked, but it needs to be coordinated well and not, because the way I see it, it's like a handicap system, but it just needs to be formalized so that programs and the activities can be sustained. So based on from the events that took place, from the droughts to the floods and king tides, we had a post-disaster needs assessment. And some of the recommendations we had already known. We needed to have an environmental health unit, but with that also, capacity building and management need to be in place. So then we realized that training must be in place, must start at some point. And it started last year. It started last year with great assistance from PIHOA, CDC, and WHO, and I'm going to continue to mention their names because had it not been them, we would not have been able to start the program altogether. So on the right side, it goes to show, and in Emmy's presentation, we started doing some enhanced monitoring and surveillance. And that's when we were able to identify a surveillance officer to kind of ensure that we do proper data management and also early warning systems and notifications. So we were able to train a surveillance officer. Now he's able to shoot out and disseminate weekly communicable disease reports and weekly sit reps on any issues that notifiable diseases that comes through the marshals that we see. Health communication system is the third recommendation I put there as unmet because it's mostly on the outer island that we need to improve and put in place. We need to have proper communication systems so that in the event of an emergency that we're not able to reach out to them. We're calling them with HAV radios or calling, you cannot contact them. So could you just imagine if there is a big event coming and you're not able to reach your loved ones in the outer islands? We don't have that in place. We don't have the capability in place. So it's unmet, and I'm happy to share that CDC has allowed some funding for us to improve the communication infrastructure. So this is through the FEP funding. The other recommendation is to improve or to revise the existing Health Emergency Act, because it's not very health friendly. And that means it's not targeted towards any health events. It's mostly on, man-made or just natural events. But if we ever come down to have any health-related events, it's not gonna. It doesn't cater towards that. So that's what we're working with the Attorney General's office. We're also working with the Office of the Chief Secretary. We have a new Chief Secretary in place, and he's really, really in support of some of the recommendations and really getting some of the activities in place. So what's in the pipeline? What are we going to do next in terms of all these events that's coming in place that we're facing? As mentioned, we have confirmed that WHO is going to assist us to localize and marshalize an environmental health framework. And I've also got confirmation that PIHOA is going to be helping us in this manner. So Dr. Grayson at the Vector Control, we just have to confirm the time. So he's going to be coming through. So I'm really, really excited about this. So we're targeting for July. So whoever wants to come, let me know. The Environmental Health Governance Task Force, I'm happy to share that, government has really shown some support and they've officiated this task force. And it's going to, under Linda's leadership, they're going to start doing some ground level work to ensure that policies are revised and also endorsed and implemented. Disaster preparedness management mapping. Now, this is in terms of how we respond in terms of an event. And Josie and some of the colleagues mentioned of the incident command structure. In the event that there is a Category 3 event, how do you respond to that? In terms of this international health regulations, they also have their own system. So what we did was we brought the two systems, say, okay, do not think of what the outside or what the donors want. We're going to retrofit it to the local setting, and we're going to do it to our way, and also ensuring that it's going to meet the requirements. Yeah? Because we have to take ownership of that. Yeah. So that's in place. We also have a Parliament budget hearing, and that's very important because this is where we're all talking about funding and how we're going to sustain the activities, and I'm really happy to share that our environmental health budget, our work plan has made the second round of review, so it's going to the final phase of budget hearing. So that's to take place in August. So very excited for that. There's also a National Donor Development Agency CROP meeting, and this is being organized by the Chief Secretary and his team. We realize that there are so many frameworks. We realize that there's so many plans that have not been implemented and put into action. So what did the Chief Secretary say? Let's get into place and work on this and try to get everybody to streamline and modify the plans to retrofit, and also working towards and revising our national strategic plan. So again, I invite you unofficially. So we're gonna, the next one is also in October. That's once we get the funding. So I'm assuming it's gonna get funded. So we'll officiate the environmental health unit. Great. And then lastly, I put this last because I wasn't sure if I should put there, but I think this is a great forum to start new allies and start new relationship and start new collaboration. So I foresee this ACGI to be our new partners to ensure that the work continues. So I put May because we're here in May, so this is starting of a new relationship. So hopefully we continue to have that. So in saying all of this, I end our presentation today with another leadership global advocate, climate change advocate. So this, Madam Chair, I promise this is my last one.
Dear Matafele Benum, you are a 7-month-old sunrise of gummy smiles. You are bald as an egg and bald as the Buddha. Your thighs that are thunder, shrieks that are lightning, so excited for bananas, hugs, and our morning walks along the lagoon. Dear Matafele Benum, I want to tell you about that lagoon, that lucid, sleepy lagoon lounging against the sunrise. Men say that one day, that lagoon will devour you. They say it will gnaw at the shoreline, chew at the roots of your breadfruit trees, gulp down rows of your seawalls, and crunch through your island's shattered bones. They say you, your daughter, and your granddaughter too, will wander rootless, with only a passport to call home. Dear Matafele Benum, don't cry. Mommy promises you, no one will come and devour you. No greedy whale of a company sharking through political seas, no backwater bullying of businesses with broken morals, no blindfolded bureaucracies gonna push this mother ocean over the edge. No one's drowning, baby. No one's moving. No one's losing their homeland. No one's gonna become a climate change refugee. Or should I say, no one else. To the Carteret Islanders of Papua New Guinea and to the Taro Islanders of Fiji, I take this moment to apologize to you. We are drawing the line here. Because baby, we are going to fight. Your mommy, daddy, boo-boo, dimma, your country, and your president too, we will all fight. And even though there are those hidden behind platinum titles who like to pretend that we don't exist, that the Marshall Islands, Tuvalu, Kiribati, Maldives, and Typhoon Haiyan in the Philippines, and floods of Pakistan, Algeria, and Colombia, and hurricanes, tidal waves, and earthquakes didn't exist, still, there are those who see us. Hands reaching out, fists raising up, banners unfurling, megaphones booming, and we are canoes blocking coal ships. We are the radiance of solar villages. We are the rich, clean soil of the farmer's past. We are petitions blooming from teenage fingertips. We are families biking, recycling, reusing, engineers dreaming, designing, building, artists painting, dancing, writing. We are spreading the word. And there are thousands out on the street, marching with signs, hand in hand, chanting for change now. They're marching for you, baby. They're marching for us. Because we deserve to do more than just survive. We deserve to thrive. Dear Mata Filipinum, you are eyes heavy with drowsy weight. So just close those eyes, baby, and sleep in peace. Because we won't let you down. You'll see.
Kathy is, she's the president's daughter, Kathy Jedno Kachinar, and she's one of our climate change leaders, youth leaders, and champion. And she's really taken up climate change, especially in, she's not only representing Marshalls, I like to say that, she's representing everybody. And her messages are always so strong, and I wanted to share that with you guys because that's what we're all here. We're all here to discuss all this and what actions can be taken. So, Madam Chair, colleagues, thank you so much for the opportunity. Komol Tata.